Getting older does not mean you are destined to feel tired, sluggish, or constantly deal with tummy troubles. Many people aspire to age gracefully, and this aspiration extends beyond outward appearance. It truly means feeling well, having abundant energy, and fully embracing life. However, as we age, our bodies naturally change, and sometimes we might not feel as vibrant as we once did. Often, when seniors feel a bit off, perhaps more tired than usual, or experiencing bloating and discomfort, they might simply attribute it to old age. Yet, there is a hidden part of your body that plays an enormous role in how you feel every single day: your gut. Your gut, or digestive system, is incredibly important for your overall health, particularly as you grow older. Taking a closer look at your gut health through specialized tests can provide powerful insights, helping you understand the reasons behind certain feelings and guiding you toward changes that can lead to a more energetic, comfortable, and truly graceful aging experience. Your gut acts as a central command hub for many processes throughout your body. As you age, the efficiency of your gut can shift, impacting much more than just digestion. For instance, a significant portion of your body's defense system, roughly 70–80%, resides within your gut. If the balance of good and bad bacteria in your gut, collectively known as your microbiome, becomes disrupted, it can weaken your immune system, potentially leading to more frequent illnesses or increased inflammation, which is when your body's defense system becomes overactive. Beyond immune health, your gut and brain are in constant communication through what is termed the gut-brain axis. A healthy gut can contribute to maintaining sharp memory, improving focus, and even elevating your mood. Research, including studies published in gastroenterology, demonstrates a strong connection between gut health and brain health, which may help reduce the risks of memory problems and feelings of sadness. Furthermore, as we age, our bodies sometimes struggle to absorb essential vitamins and minerals from the food we consume. A healthy gut is vital for this absorption process. If your gut isn't functioning correctly, you might miss out on crucial nutrients, even if your diet is otherwise good. Your gut also influences how your body processes sugar and fat, playing a role in your metabolic health. A healthy gut can help stabilize your blood sugar and manage your weight, both important for preventing issues like type 2 diabetes. Additionally, strong bones require sufficient calcium and vitamin D, nutrients that your gut helps you absorb. Poor gut health can therefore affect your bone density, making bones weaker. When your gut is thriving, your body can produce more energy, whereas a struggling gut can lead to persistent tiredness and a general lack of enthusiasm for life. Lastly, a well-functioning gut can significantly lower the risk for many health problems that become more prevalent with age, such as heart disease and certain types of cancer. Understanding more about your gut is the crucial first step toward improving your overall health. There are several important tests your doctor might recommend to give you a clear picture of what is happening inside your digestive system. One such test is the Comprehensive Stool Analysis, CSA, often referred to as a poop test, or gut microbiome testing. For this, you collect a small stool sample, which a lab then analyzes in detail. They use advanced methods, such as looking at the DNA of bacteria, often called 16S rRNA gene sequencing, to identify all the tiny living things in your gut. This test reveals the balance of good and bad bacteria in your gut. An imbalance, known as dysbiosis, can cause various problems. It can also detect unwanted inhabitants like parasites, yeast, such as Candida, or specific harmful bacteria. The CSA checks how well your body is breaking down fats and other foods through digestion markers, and it looks for signs of inflammation in your gut, such as specific proteins like calprotectin. Moreover, it tells you if you have enough helpful bacteria like lactobacillus and bifidobacterium, and it measures short-chain fatty acids, SCFAs, like butyrate, which are beneficial chemicals produced by healthy gut bacteria and are important for gut health. This test is like a detailed map of your gut, helping doctors identify the root causes of many issues, ranging from bloating and gas to chronic tiredness and nutrient deficiencies, thereby providing a personalized plan for improving gut health. According to a review in the journal Gut Microbes, understanding the gut microbiome can guide specific treatments for age-related conditions. Another valuable test is the small intestinal bacterial overgrowth, SIBO, breath test. This is a simple and non-invasive procedure where you drink a special sugary liquid, usually lactulose or glucose. Then you breathe into a series of small bags every 15-20 minutes for a few hours. A lab then measures the types of gases, like hydrogen and methane, in your breath. If an excessive number of bacteria are growing in your small intestine, where they should not be present in large quantities, they will consume the sugary liquid and produce these gases. These gases then travel to your lungs and are exhaled. High levels of these gases indicate a likely SIBO diagnosis, a condition that frequently causes bloating, gas, abdominal pain, and changes in bowel habits. SIBO is more prevalent in older adults, partly because digestion tends to slow down with age. Since SIBO symptoms can easily be mistaken for other common digestive issues, this test can help pinpoint the actual problem. Clinical guidelines from the American College of Gastroenterology highlight breath testing as a key diagnostic tool for SIBO. Celiac disease and gluten sensitivity testing are also important considerations. For celiac disease, blood tests check for specific antibodies, which are proteins your immune system makes, that react to gluten, a protein found in wheat, barley, and rye. Common tests include TTG-IgA and EMA-IgA. Genetic testing can also determine if you carry certain genes, specifically HLA-DQ2 and HLA-DQ8, which increase your likelihood of developing celiac disease. If blood tests are positive, a doctor might perform an intestinal biopsy using a small camera procedure called an endoscopy to take a tiny tissue sample from your small intestine, which is the most definitive way to diagnose celiac disease. For non-celiac gluten sensitivity, NCGS, where you react to gluten but do not have celiac disease, there isn't a single specific test. Diagnosis often involves ruling out celiac disease and then observing if symptoms improve when gluten is removed from your diet. These tests reveal if your body has an autoimmune reaction to gluten, as in celiac disease, or a strong inflammatory response to it, as in gluten sensitivity. Celiac disease and gluten sensitivity can manifest with various symptoms in older adults, extending beyond digestive issues to include tiredness, anemia, low iron, weak bones, osteoporosis, and even problems with thinking or memory. If left undiagnosed, these conditions can lead to serious health complications. A study in the Journal of the American Geriatric Society noted that celiac disease is often underdiagnosed in the elderly due to its varied symptoms. Another crucial test is for Helicobacter pylori, H. pylori, a type of bacteria that can reside in your stomach. Tests include a urea breath test, where you drink a special liquid and your breath is tested for a specific gas, and a stool antigen test, which looks for H. pylori proteins in your stool. A blood antibody test checks for antibodies to H. pylori in your blood, indicating a past infection. In some cases, an endoscopy with a biopsy may be performed, where a doctor uses a small camera to examine your stomach and takes a tiny tissue sample to check for the bacteria. These tests determine if you have an active H. pylori infection, which is a common cause of stomach inflammation, gastritis, ulcers, and can even increase the risk of stomach cancer. H. pylori infection becomes more prevalent with age, and a long-term infection can lead to ongoing stomach problems and hinder the absorption of important nutrients like vitamin B12 and iron, resulting in tiredness and other health issues. According to the Centers for Disease Control and Prevention, CDC, H. pylori infection is a major cause of peptic ulcers. Finally, inflammatory bowel disease, IBD, markers, such as fecal calprotectin and lactoferrin, are special stool tests that measure specific proteins released by white blood cells into your intestine when inflammation is present. High levels of these proteins suggest active inflammation in your gut, helping doctors differentiate between common digestive discomforts like irritable bowel syndrome, IBS, and more serious inflammatory conditions such as Crohn's disease or ulcerative colitis, which are types of IBD. While IBS symptoms can feel similar, they typically do not involve this kind of inflammation. IBD can sometimes emerge or reactivate in older age, making these tests a simple, non-invasive way to screen for inflammation. If levels are high, it can prompt your doctor to conduct more detailed examinations, like a colonoscopy, to identify the cause of the problem. Research in the Lancet Gastroenterology and Hepatology supports the use of fecal calprotectin as a reliable marker for intestinal inflammation. Receiving your test results can feel like unlocking a secret message about your body, but you do not have to decipher it alone. It is very important to work with a healthcare professional who understands these tests, whether it is a gastroenterologist specializing in digestive issues, a functional medicine practitioner, or a registered dietitian. They can help you understand what your results mean within the context of your overall health, as attempting to interpret complex medical results independently can be confusing and lead to incorrect conclusions. Based on what your tests reveal, your healthcare provider will help you develop a personalized action plan. This plan might involve dietary adjustments, lifestyle changes, or specific supplements. For example, if SIBO is diagnosed, the plan might focus on special diets and targeted treatments to reduce bacterial overgrowth. If low levels of beneficial bacteria are found, it might involve incorporating more fermented foods into your diet. Sometimes, improving gut health takes time, so your doctor might suggest follow-up tests after a few months to assess the effectiveness of your changes and whether your gut health has improved, allowing for fine-tuning of your plan as needed. While these tests provide valuable information, nurturing your gut through healthy daily choices is how you build a strong foundation for digestive wellness. Prioritizing dietary approaches means focusing on whole, unprocessed foods like fresh fruits, abundant vegetables, whole grains such as oats and brown rice, lean proteins like fish and chicken, and healthy fats from avocados and olive oil, as these provide the natural building blocks your body needs. Incorporating fiber-rich foods is essential, as fiber acts like a broom for your gut and nourishes your good bacteria. Natural sources include berries, leafy greens, beans, lentils, oats, flax seeds, and chia seeds, which promote regular bowel movements, feed beneficial gut bacteria, and help maintain steady blood sugar. Prebiotic foods, which are special fibers that specifically feed the good bacteria in your gut, are also beneficial. Garlic, onions, leeks, asparagus, slightly underripe bananas, and chicory root are natural sources that help your good bacteria grow and thrive. Adding probiotic-rich fermented foods, which naturally contain good bacteria, can further enhance gut health. Look for yogurt with live and active cultures, kefir, sauerkraut, kimchi, tempeh, and kombucha, but start with small amounts if you are new to them. Adequate hydration is crucial, so drink plenty of water throughout the day, as it is essential for digestion and nutrient transport. Conversely, try to limit or avoid processed foods, excessive sugar, artificial sweeteners, unhealthy fats found in fried foods, and any specific foods that your tests or your body indicate cause problems. Alongside dietary changes, several lifestyle factors contribute significantly to gut health. Effective stress management is key, as stress affects not only your mind, but also your gut. Finding ways to relax, such as mindfulness, meditation, gentle yoga, deep breathing exercises, or spending time in nature can be highly beneficial. Regular physical activity, even moderate exercise like walking, swimming, or light strength training, helps your gut move food along properly and can reduce stress. Aim for 7 to 9 hours of quality sleep each night, as your gut, like the rest of your body, uses this time for rest and repair. Practicing mindful eating by not rushing meals, chewing food thoroughly, aiming for 20-30 chews per bite, and paying attention to taste and how your body feels helps initiate proper digestion. Sometimes diet and lifestyle changes alone may not be sufficient, and your doctor might suggest specific supplements to support your gut. It is crucial to always consult your healthcare professional before starting any new supplement regimen, especially if you are taking other medications. Probiotics are supplements containing live beneficial bacteria that help restore a healthy balance of gut flora, improve digestion, boost your immune system, and can alleviate symptoms like bloating and gas. A meta-analysis published in the Journal of Clinical Gastroenterology found probiotics effective in reducing bloating and abdominal pain. Doses vary widely, often measured in billions of CFUs, colony-forming units, per dose, with specific strains often recommended for particular issues. They are available in capsules, powders, or chewables, and it's important to choose brands that ensure the bacteria survive stomach acid. Some individuals might experience mild gas or bloating when first starting probiotics, and those with very weak immune systems should consult their doctor beforehand. Prebiotics are supplements that provide the specific type of fiber that feeds your beneficial gut bacteria, helping them grow and produce helpful substances for your gut lining. Common types include inulin, fructooligosaccharides, FOS, and galacto-oligosaccharides, GOS, usually taken as powders or capsules. They can cause gas and bloating, especially when first introduced or taken in large amounts, so it is best to start with a small dose and gradually increase it. Digestive enzymes can be helpful because as we age, our bodies may produce fewer of these chemicals that break down food. These supplements aid your body in breaking down carbohydrates, fats, and proteins more efficiently, thereby improving nutrient absorption and reducing discomfort like bloating and gas. A study in current drug metabolism highlighted the role of enzyme supplementation in improving digestion. Look for broad-spectrum enzymes containing amylase for carbohydrates, lipase for fats, protease for proteins, and sometimes lactase for dairy, typically taken as capsules with meals. They are generally safe, but if you have specific medical conditions like pancreatitis, consult your doctor. L-glutamine is an important amino acid, a building block of protein, vital for the health and repair of your intestinal lining. It helps strengthen the gut barrier, potentially reducing leaky gut, a condition where unwanted particles pass through the gut wall. A typical dosage is 5 to 10 grams per day, often split into smaller doses, available as a powder to mix with water or in capsules. While generally safe, individuals with kidney or liver problems should consult their doctor. Omega-3 fatty acids, EPA, DHA, are powerful anti-inflammatories that can help reduce gut inflammation, support the gut barrier, and encourage a healthy balance of gut bacteria. Research in nutrients indicates omega-3s can modulate the gut microbiome and reduce inflammation. These healthy fats are found in fatty fish like salmon and mackerel, flax seeds, and chia seeds, and can be supplemented through fish oil or algal oil for plant-based options. They can sometimes interact with blood-thinning medications, so it's important to choose high-quality supplements tested for purity. Vitamin D-tachin is crucial for a strong immune system and plays a role in gut health by influencing the types of bacteria in your gut and helping reduce gut inflammation. Clinical dosages vary based on individual blood levels, often ranging from 2,000 to 5,000 IU day of vitamin D3, which is the most effective form. Regular monitoring of blood levels is important, as very high doses can be harmful. While this information provides general guidance, your personal health journey is unique. It is always wise to consult your doctor if you experience persistent or worsening digestive symptoms such as ongoing pain, bloating, diarrhea, or constipation that does not improve with simple changes. Unexplained weight loss or changes in appetite warrant medical attention, as these can signal more serious underlying issues. The presence of blood in your stool or dark tarry stools requires immediate medical evaluation. If you have a family history of gastrointestinal diseases, you might need earlier or more frequent screening. Additionally, always talk to your doctor before starting any new dietary changes or supplement regimens, especially if you are already taking other medications, as some supplements can interact with them. Tiredness, bloating, and other digestive discomforts are not simply an unavoidable part of getting older. Your gut health profoundly impacts how well you feel, your energy levels, and your overall well-being as you age. By considering some of these key intestinal tests, you empower yourself with valuable knowledge about your body. This information can help you and your doctor create a personalized plan to improve your gut health. Investing in your gut health today is a powerful step toward a more vibrant, comfortable, and truly graceful tomorrow. Listen to your body, communicate with your doctor, and take proactive steps to nurture your gut for a healthier life ahead.